All right. Well, good morning, everybody, and welcome to our booster for standardizing data across counties. My name is Krista Brown, and I am the APS Leaders Institute Program Coordinator with APS Workforce Innovations, APSWI, and I'm here with Rabaz Taha, our training operations coordinator, and I will facilitate and Rabaz will be doing Supreme Tech Support today, and we're here with Lori Delagrammaticus, our colleague from NAPSA, who will also be helping. And we're very, very pleased to have on pretty short notice, Robin Tejeda and Stephanie Schneider are joining us from Nevada. And I'm going to go ahead and introduce them and then go through some housekeeping and then hand it on over to them to talk about data. Robin has been with the State of Nevada Aging and Disability Services Division, ADSD, for 16 years. She's been the APS Quality Assurance Manager with the Quality Assurance Unit since June 2017. And in this role as the APS QA Manager, she identifies areas of program improvement and continues the development of the QA program for APS. She has an extensive background in the area of quality improvement, federal and state regulations, and her prior role before QA, she worked as a social work supervisor at ADSD's community-based care unit for 6 years and a social work case manager for 6 years. And she is a licensed social worker in the state of Nevada and has a master's of science in education counseling. So welcome, Robin. And we also have Stephanie Schneider. And Stephanie has an extensive background in the medical field, working as a certified nurse assistant for over 10 years, advocating for patients residing in long-term care facilities, providing in-home and inpatient services for patients on hospice, and also worked in acute hospital settings. She left the medical field and continued her education and obtained a master's of science in psychology with a specialization in health. And Stephanie has been with the state of Nevada ADSD for 4 years. And in her QA role, she is assisting identifying areas of program improvement and continues to collaborate with the development of the QA program. And Stephanie has an extensive background in the area of health advocacy, federal and state regulations, and her prior role with the state of Nevada was with the long-term care ombudsman program in rural Nevada. So welcome, Stephanie, as well. We're really, really excited to have you both. So we're recording this presentation to share with your colleagues who weren't able to make it today. If you haven't done so already, please go ahead and type your name, your title, your county into the chat box and let us know if there's anything that you are hoping to take away from this workshop today. All right, let's go into some of the housekeeping. As we have discussed numerous times, APSWI is a program of the Academy for Professional Excellence, and the APS Leaders Institute is a program of APSWI. And APSWI as a whole provides innovative workforce development to APS professionals and their partners. And the Academy for Professional Excellence provides workforce development to a broader health and human service professional base. And there are our Academy programs there on the right. We have added something, a group agreement, just a way to set the stage to have a safe learning and sharing environment. So we ask that our attendees and facilitators and presenters default to inquiry rather than defensiveness, practice non-judgmental and respectful interactions, practice self-awareness with attention to impact on oneself and others, and contribute to a supportive, strength-focused learning environment. And we'll make sure that we're abiding by that as well. So thank you for that. And our Zoom settings, oh my goodness. I think we all know Zoom by now. So please please go ahead and make yourself muted when you're not speaking. We love to hear from you. So unmute, ask questions, and also love to see you. We're still a little starved for human interaction. So go ahead and turn your cameras on if you're able. We'll have breakout groups. Awesome to turn your camera on in the breakout group. If you need to step away, go ahead and give us a be right back, BRB in your chat box. That helps with our breakout group, dividing you into groups. And then we have hand raising and thumbs up and all kinds of fun things in the reaction. So feel free to use those as well. So today we're together from 10 to 11:30, and we're going to hear from Robin and Stephanie. We're going to break up into some small groups, and we're going to have another discussion question. Today is about data curiosities and data anomalies. So thinking about the SOC 242 e-learning that many of you either completed or in the process of completing, thinking about the new SOC 242 data dashboard. CDSS did a training with that. Maybe your folks are kind of messing around with data, and maybe you're seeing some interesting things in sharing that with your regional colleagues. So we'll take some time to do a breakout group around some specific questions. And then we'll come back together, we'll process, and then you will take your last end of day survey and post test for a little while, because this is our last booster for the fiscal year. And we'll come back next fiscal year and we'll have you do less evaluation, I promise. So just one more time. And then Rabaz has put into the chat box a link to the participant manual. That's where all the slides and fillable PDF, you can take notes, and that's where the breakout group questions are. And then we also gave you the SOC 242 demographic handout and the FAQ handout. So I think that is... Oh, before we get started, were there any questions or any additional sharing from our May 19th workshop and breakout group? I know that really good information. We got lots of notes. If there's anything else you want to bring in from that today, please do. I believe Patrick, who from Orange County, isn't on today, but his group shared the data element that he was interested in digging into was the SOGI data. I remember that was what he shared with his group. I'm sure all the other groups had some really interesting things to share as well. So any questions before we hand it on over to Lori? To Stephanie and Robin and Lori. All right. Okay. Well, then we'll get going here, and let's see. Let me get out of that. There we go. All right. So Robin and Stephanie, just tell me when you need me to move your slide.
I think when you can move your slide. Next slide, yes. Sorry, I lost my train of thought. A little bit about our little unit. It's just the two of us, and we also do quality assurance for the long-term care ombudsman program. So we're a little busy. Nevada is not a very big state, so APS here in Nevada is under our state agency. We have 4 regional offices, and so that's kind of where we do our comparative data between offices and even between workers. And 4 years ago, when I was moved into this position, APS was already working within a case file review form, and there wasn't any real mechanism to evaluate the data based on those. I mean, it was a good tool for the supervisors to use with their staff to indicate possible errors, things like that. So over the last 4 years, we've created like a little database, if you will. We call it a mini database, where we have a data line that we put into this database, and then we look at data and look at trends within our case file review form. So that's one area that we look at data. And then the other that sounds more similar to this form that you keep referencing is when we moved into Namers, I I think it was 2017, Nevada was given an expansion grant to use for namers, for us to have our database be namers friendly, if you will. So we added some additional data elements, all sorts of stuff. It's still going on actually. Right now we're still working on it. So those are two areas where we collect data and look at it for trends, compare things like that. So we wanted to start out with our mission statement that Stephanie and I, with my supervisor, came up with. Our mission is to provide quality assurance oversight for adult protective services and long-term care ombudsman program, and identifying areas of improvement and to assist the developing solutions to ensure highest level of services are provided to Nevadans. And a lot of that has been done through looking at data. What were you calling it earlier, Krista? Questioning? Is it data?
Yeah, data curiosity and data anomalies. Yeah.
Yes. So we're going to go through just some of the ones that I thought might highlight and be helpful to someone else to look at. So next slide, Stephanie.
All right. Part of our strategy as far as how Nevada's quality assurance team uses data through APS data, there's evaluating unknowns on substantiated cases, over 60 under 60 population, unable to contact clients, substantiation decision rate, and case file review data. So these are some examples that we're going to review.
So the first one, I keep looking at, I have the slides up over here. I'm like, why am I doing that? They're in front of me, sorry. Evaluating unknowns on substantiated cases. When we first started having data available to us through the namers changes, we had unknown as an option. And so the first time that our project manager came out with, this is kind of the data, what's showing for the options, like example, language, unknown language, so English, Spanish, whatever we have in those sections. And I looked at it and we divided between unsubstantiated cases and substantiated cases when we were looking at the namers data. And my first thought was some of these unknowns, if the case was substantiated, more than likely the investigator had seen the client. So we honed in specifically to start on language. So substantiated case, unknown language. And so we ran a report just on those, and we looked at into all those cases, and we analyzed what region, even it ended up being one region and a specific worker that was giving these unknowns, and we were able to identify that he just wasn't updating what was in the system from the original intake, because it kind of feeds into intake into the case. And so it was some needed training, but that would be a good way to look to see if you have good data, is looking at substantiated cases with unknown values, if that's an option for your form that you had. And then we also have a report within our system. It's the missing data report. And to assist the investigators when they're wrapping up their cases or going through their cases, they can run this missing data report on their case. And red comes up with values that are missing that need to be there. And then purple is unknowns. So a supervisor can look at that real quickly and see if there's a case that has a lot of unknowns. Why is that? Is it appropriate to have unknowns? If they were unable to get in contact with the client, and it would be appropriate to have some unknowns in those sections. But if they met with the client, they spoke with the client, and they still write unknown for language, that some of those areas weren't updated. So that's how we used comparative data with unknowns. So next slide.
And then another area that was reviewed was over 60 and under 60 population. And this was through our expansion grant, which was when APS, was it 2019, correct? Correct. Prior to that, Nevada only served the population for elder protective services, which was individuals 60 and older. And so through that session, the Nevada expanded to serve populations of vulnerable adults ages 18 and up. So we were specifically wanting to ensure during that transition that both populations essentially were being provided similar services, and they were both, that the expansion didn't essentially wanted to see if it changed. So an example is when we pulled from the APS database is the ability to determine trends among the different populations. So part of those trends, we showed some examples here that would show just the difference in allegation types. On here is listed APS, which is essentially 18 to 59, and then 60 and older would be under the EPS category. So under those different sections, we were able to identify just different trends among the populations. So same thing with the client sector, as far as which cases we were receiving, which is information that we submit to namers too. So.
Stephanie, I don't mean to interrupt, but I think your computer mic is picking up the fan in the back, so it's making you sound a little choppy.
Oh, okay.
Yeah, no problem.
Thank you.
And I think Robin too, folks are having a little bit hard time hearing, so.
Let me see if I can
get closer.
I'm like,
thank you.
All righty, I'm trying to turn up my volume. Is that better?
Yeah, it is.
Okay.
Thank
you. I don't like it closer to me because my face looks so big on the screen.
Robin, if you go into your microphone settings down at the bottom and click on the little caret, there's audio settings and there's a setting to suppress background noise. And if you set that on high, you guys might not get so much background noise, both of you.
Where do we go?
On the toolbar down at your microphone.
Okay.
Hit the little caret to go to audio settings. And in audio settings, there's suppressed background noise. And if you set it on high, they don't hear typing or dogs barking or so on. It helps focus it just on you.
Okay, I did that. So hopefully that's better.
Thanks, guys. Sorry about that.
Oh, no, it's fine.
Thanks, Lori. That's something new for learning. Thank you.
How's mine? Better?
You sound good now. Yeah, no, I learned it because I have a fountain for the animals that you always hear in the background if I don't do it.
Great. Thank you.
Thank you, Lauren. And to kind of recap on this slide, like Stephanie was talking about, we've been at the additional population for 2 years. So this isn't really anything right or wrong that we look at. We just look at trends because we don't know yet what, because it's that population is new to us, under 60. So we just take note of interesting trends, like in the older population, cases tend to be more female, like 60 to 40%, where the under 60 population almost appears to be even when we look at quarter data through the years, and it's been trending that way this whole time. So this one we just note, we're just watching it because it's new to us, but our data analytics team with the Department of Health and Human Services here in Nevada, they came up with that we should be receiving about 13 to 14% of our cases should be under 59, and we're actually kind of matching that, which I think is interesting. Like these data nerds, they knew that based on our population, and they took a couple counties from California, one from Texas, one from someone else, and they kind of guessed what our new caseload would look like, and they were pretty right on. So we're receiving our cases tend to be between like 13-15% under 60 for now. We're doing some, PR campaigns, things like that, because it's pretty new to the public, only being 2 years old that we've been serving the younger population. So we thought it was interesting and wanted to show you how we're using them. And this is also pulled out of these NEMA reports that we have. Okay. Please. Okay. Hey, can you hear me better now? Okay. This is something actually that we're working on right now, building a report with our project manager. And this is pulled out of our system, which I'm gathering is similar to the form that you've referenced. It's a form and a database. They're featuring all of this stuff in the investigator. And so through some case file reviews, we were starting to see trends regarding specific workers who either have decreased or increased success rate in conducting visits. So actually meeting with the client. So Stephanie and I have some suspicions, but we're trying to like proven data that certain workers have more higher percentage rate of maybe client services are unable to locate client. And so he's almost done with this report, looking at for us, Cherise. And we think we'll be able to take this to the program and the supervisors and have them maybe provide some additional training for specific workers or specific workers in a region. Because it's clear to Stephanie and I, when we're reviewing cases, that there's workers that seem to have lots of client services, client visit. So could we be providing additional support to them to be more successful when they're interacting with clients at the first visit? And we want to take, our goal is to take like a sample of 3 months, 6 months, and come up with like an average of a success rate, and then compare it to the success rate of visits to individual workers. I could be wrong, but it's just something that is coming up when we're actually going in and physically doing like case file reviews and looking at cases in the system. So that's where you could maybe look. I don't know if that's an option on your form, like success rate of the visit or not. Maybe something to look at. Next.
Robin, I just have a quick question, and I'm sorry if I missed this. So are you going to check back in after training is administered to look for change? Did you say that that's what the 3 and the 6 month is about?
At first, we're gonna look at three months worth of like post data and 6 months to kind of come up with an average to pinpoint maybe a region or certain workers and to kind of validate our suspicions. And yes, we would look again after a duration of time to see if training provided or intervention provided.
Intervention, yeah, coaching or,
Yeah,
yeah.
would it assist in making that better? And I could see that they have the particular workers just have clients that don't want to see them. I don't know, my suspicion, like when we're reading cases, it's just like, this is interesting, like, so we just need a report. We can't just be like, hey, we think the worker needs some training, I mean, we could, they would probably listen to us, but I want something like more substantial, if that makes sense, but we would go after.
Right.
Didn't we have a discussion, Robin, about maybe it was either with you or with Chris about somebody had a huge number of unable to locate clients, and it turned out they were assigned an area of transient population. It's like, so you got to look past just the data and do a little bit more thinking through if there might be a good reason why that data is bizarre, right?
Yeah, sure.
So there could be.
And it's interesting you bring that up because the workers have been like, like look, they're in Las Vegas, which is our biggest metropolitan area in this, the state, and that's pretty transient area. So that's some great points for sure. So yeah, we'd have to look into that further, but at least the report's gonna give us a big thing.
Chris, I hope I didn't steal your thunder.
Oh, no, I think that was a great example I had shared at the last training, just that you have to be curious about what it means, because we initially thought we had a problem worker, and actually we found out we really didn't when we dug in.
Well, that's even better. Sure. Are you on this side, Miss Stephanie?
So the next example we're providing is a substantiation decision rate. So we utilize the average substantiation rate versus the regional rate. And then brought us to regional specific worker, and then regional rate is essentially at 28% versus specific worker we found was at 8%. So determination required additional training for specific investment and also the unit supervisor. And then additional statewide training came from that for consistency among substantiation decisions. So by doing that, there was implementation of the utilization of the findings matrix with the PA for consistency and findings on substantiation decisions. So essentially there was some cases that were very similar where one would be substantiated and the other wouldn't. So we wanted to ensure that everyone was understanding, for one, the allegation, the definition in law, examples of that. And then that way they could make a determination for substantiation a little bit more consistently among not only just workers, but statewide.
And then Stephanie are still working on this. This was like a really like a very big project for us. Because like I said, it's for now, we're approved for 3 additional positions. Yes, we got to hire someone else in July and 2 more in October. So Stephanie and I are very excited. But this is actually a project that we worked on with Lori for a PA project with ACL. Correct me if I'm wrong, Lori. And Stephanie and I identified this area to Tammy, the chief, where we're reading cases and they're very similar, but the substantiation decision is completely different. So there's an inconsistency problem. So we worked on this TA project, and with the help of Lori and Mary Toomey, we came up with this. I think this is actually from California.
That was what I was going to say. The gang on this call helped develop the consistency of findings matrix and the training that's done in California. And you guys are rolling that out again, I think.
I'm sorry, you're talking to California, not me. I was like, how we are. Sorry. So we did a complete review and we gave the findings to the program. We did a training. We sent out all of these, consistency matrix, did a training, and now we've done another review and we're compiling the data to see if the training and the matrix helped with consistency. So it's exciting. I think that we're actually finding that the consistency, I haven't tallied the data yet, but I'm just doing the reviews and talking to Stephanie. It seems like the consistency is better with individuals above 60, but we still are consistency with our new population and substantiation decisions. So I think it should be interesting, and we'll probably need to find another training. That's okay, it's getting better.
So I just have a question about that. So this is part of your ACL grant. Is there going to be some sort of like white paper or anything? Because California created the whole consistency thing, and then we're all circling back. So Southern California counties are getting a really intensive right now. I believe Northern counties consistency and findings is rolling, and I'm assuming the Central probably will as well. I'm just curious. It might be interesting just for California to just know how it rolled with you and.
Well, it was a TA project, so it was different than one of our grants.
Mm-hmm.
And, we just received some assistance. Lori could probably articulate this way better than me. She was on the TA, providing the TA support for us through ACL. I think it was a grant that they received to provide TA support to.
Right.
So I wasn't planning on doing a white paper, but I mean, we could look into that if it's helpful.
So Lori,
I don't
Lori,
think there was a white paper.
Is there any summative, anything for the TA, those TA projects from ACL?
No, we had like 30 hours of TA we could provide to.
Okay.
And during that time, when we identified policy changes or places where TA was needed, Nevada and North Dakota both said consistency of findings were an issue. And they both asked for state-specific consistency of finding matrix that they could use. And it works really well across the country. There were some differences. I believe in Nevada, their definition of sexual abuse includes you have to be touching the person. So we had to do some, you know what I mean? Which is a little different than California, where forcing someone to watch pornography or taking photos of them also would be included in that. So we had to do some adjusting, but we didn't do follow up at that point. And it might be a really nice project at some point to, when you go to look at whether training on consistency of findings makes, improves the data, maybe that's a place to partner and look across states as well as across counties. Some of the things Robin is talking about, it's just it's a mindset of how you look at, you've got the data in front of you, what stands out and what are you looking at? And for them, this was just like California, a big deal. And I think we're going to find a lot of specifics. Robin, which case management system are you using?
We're in WellSky.
In WellSky, okay, which is what LA County uses as well. So when we're talking about what data you can pull, it gives people a little bit of frame of what might be available there. Thank you for that.
Next slide.
Yes, please.
Okay.
Was this my slide? I was like, oh, Stephanie can jump in on this too. Stephanie works really hard with these slides and coming up with this little dashboard for us. It's incredible what we've been able to do. Since Stephanie came on to be part of my team. So we also have a separate form that's not in the system. It is not in WellSky. It is an Excel form that the supervisors use to do a case file review. They submit it to Stephanie and I, because there's only two of us. So we do the best we can to do as many case file reviews as we can. But this is a way that we can get data from what the supervisors are seeing in the cases. And we receive those monthly. And this data represents an approximate review of about 20% of open monthly open cases for the month. To note, here in Nevada, APS supervisors do a review of all cases before they're closed. They review certain things. I mean, there's a lot of cases for them to review, so they review. So these are, the 20% is just based on the turning the forms into us. And through these review, additional data is analyzed through a mini database. So behind the scenes, where the supervisors can't see it and they can't touch it because they might mess it up. They email the forms to Stephanie. She copies over a data line and or I have Stephanie's out and puts it into a bigger Excel sheet that computes the data for us, and we're able to see like missing data points. We're able to see if dates are wonky, things like that, and then it turns it into these nice little dashboards that we have every month. We just gave this as an example because we didn't want to, we just what's something basic. And so for every question, we just reduced the questions a little because we felt like it was too much. So after July 1st, we're getting 35 questions, right, Stephanie? Instead of 48 is what it was up to. It was too much. So every month, Stephanie and I look at these dashboards to see, like, like what happened in November? It was really weird. We still don't know why. Like all the data points when we compared it like this per question, and these are just based on alcohol answers. This particular November of this last year, for some reason, all the questions took a dive. Even in long-term care ombudsman, it was like the weirdest thing. We still don't really know why. Everyone just kind of got a little squirrely in November. I don't know. We just don't know like what happened. We still can't answer it, but it was showing in the data. So we brought it to everyone's attention. We meet with the programs quarterly, and we have our PowerPoint presentation. We do not review all of the questions with the programs because we tried that and we nowhere. So we decided less was more to review with the program, and we go over them and we look at these particular pieces. Stephanie and I do a case review of the cases that are showing up, and then we try to give them an analysis of what we think is going on. And so we've discovered things as with the question that we were asking. It was no one was doing anything right or wrong. It was us. It was the question we went and see on the salary before. Right now, Nevada has a pretty substantial vacancy rate. And so a lot of we feel it going on in a lot of, the case file reviews, they're required to document within 3 business days. Well, if you're at a 40% vacancy rate, I mean, kind of timely documentation anywhere, I don't care where you are in the country, would probably go down. And so then we try to come up with reasons, and then we meet with the program, and then we provide support, and if there needs to be a policy change or a training bulletin or some sort of training provided, and then we just continue to look at the data month to month, quarter to quarter, and then every quarter we go back and we review what we reviewed with the programs prior quarter, and we talk about what worked, what didn't, what changes need to be made going forward to improve the data, to improve services that are being
Robin,
Yes.
if I may, how many questions do you review with the supervisors in those quarterly trainings? Is it like 3 or 4? Is that you
It's,
particularly?
It depends, but we try to keep it to 5. We try to keep it to one shout out. One thing that we found that was like, wow, you guys are doing this really, really well. And then we don't call them like corrections or anything. We call them for things to think about, because sometimes it's not something that you can correct, it just is. And so we've gone through like, okay, this is what we kind of found in the case file reviews. This is what we think's happening. What do you think's happening? And then after those quarterly meetings, we meet with the chief of APS and then the long-term care ombudsman of the long-term care ombudsman program. And then they kind of decide what actions they want to take. And then we come up with a plan, and then we review like that plan because we just found like reviewing all of the questions, like everyone was getting frustrated, and like we only got through like the first 5 questions, and the first 5 questions are all about like address entered correctly. I mean, yes, that's important. We wanted to get to other more important areas, and so we found that less is way more.
I want to add to you may have already mentioned this, but that's actually how this question came up, which actually came up in our second quarter, was due to one of the other questions essentially asked if a law enforcement referral was made. And through that, we were like, looking at it and we're thinking, gosh, it doesn't look like there's very many law enforcement referrals made. Why is that? And it wasn't right or wrong, like Robin said, it was just something we wanted to delve a little bit further into. When we presented it to the program, it came up where a lot of times law enforcement was already involved in the case. So the program, we kind of asked them, well, what do we want to find out? Do we want to find out if law enforcement was involved in these cases? How much collaboration is going on with law enforcement? So then this question came, and you can see, before obviously the question wasn't there, but it definitely changed the numbers even for the prior question with the referral, because sometimes there's a not applicable option. Sometimes there's just a yes, no option, depending on the question. And then there's also instructions that will help on how to answer the questions for consistency. Sorry, Robin, I didn't know if you had
Thank
Yeah, no,
you.
that's good. That's good. Stephanie, did you want to review this one?
Yeah. So in conclusion, by utilizing the data, quality assurance can deliver the data and information, inform recommendations to the program. The recommendations are based on what's received through the database and case file reviews. And they're, as we're providing recommendations, we always want to remember to be solution based to ensure that our services are provided to Nevadans. And then we have over here on the right, this is from the namers, and which is essentially just how we're drawing part of how its conclusions are being drawn to show some trends that occur. Well,
So POI is person of interest.
Yes.
Okay.
Yes, we use client and person of interest instead of victim and perpetrator. I mean, I know it's different all over, but yeah, that's the verbiage that's used here. So that's what we have for you.
Great, thank you. Any questions for Robin or Stephanie? Really interesting.
This is Lori. When I went to Nevada, I was just really impressed at how, like Stephanie was saying, solution-based, let's make our program better versus blaming their QA process was. And the big thing that really came out for me was the use of data to come up with questions, to look at policies, to adjust the policy or provide training, and then go back and look at the data. It's this circle. It's a feedback loop that they use consistently to make sure that the data really is driving program improvement. And there's just the two of them, but they really understand that this is a feedback. If it's going to be worth doing, you have to have the feedback loop there.
Yeah. I do have to give a shout out to our management analyst too, Agnes. I should have had her come too, because she monitors I don't know how to put this, like the cleanliness of data. Like she looks for anomalies too, to like missing things as well. So she's looking at different things, instead of like basics. I don't know how to explain, but she looks at things. That is not the computer, that's me. Yeah, we do have a little team. I appreciate you saying that, Lori, because we've worked really, really hard on us being viewed as a partner with the program, and this is a tool and not something that's punitive. Because I swear, when I first started this job, I was going to come out to my car and my tires were going to be slashed because everyone just thought I was like attacking them, and I wasn't attacking anybody. I was just bringing out things and data doesn't lie, and so that's how. I mean, it does sometimes. Sometimes there's anomaly, but I was able to just keep presenting the data. How can we improve this? Our goal is to serve the clients in our state. So I'm really proud of what we've done. So I'm really excited that we're getting 3 additional positions.
Yeah, congratulations. That's
you.
huge. That's huge. So awesome. Well, thank you so much. And you're invited to stay. We're going to go into a breakout group activity, but you're definitely invited, or you can dash, because I know you've got lots going on in your 2-person team. So
It'll be interesting. It'll be interesting for us to stay for sure.
Sure. Yeah, actually, we can pop you into a breakout room so you could be flies on the wall as well. So we're going to go ahead and jump back into the California mindset with the 242 data dashboard. So we're going to put you into groups. Please identify someone to report out. For about 20 minutes, we'll have you discuss how can you use the new SOC 242 data dashboard to analyze what is happening in your county. So either areas of improvement, growth, challenges, but especially areas for data curiosity or areas of data anomalies. What about as compared to other counties? And how could the new SOC 242 dashboard lead to increased consistency of data collection across counties? Now, for an example, I don't want to put Chris on the spot, but a little bird told me that there was something that came up during the APS Southern managers meeting the other day about kind of an interesting data anomaly about cases carried forward. Did you want to share a little bit about that, Chris, before we go into groups?
Yeah, we have a Southern Regional group that's part of a subcommittee of PSOC, and we were just talking about the data dashboard, and one county brought up that when they were looking at it, that their cases carried forward looked very different than the other counties' cases carried forward. And we kind of thought that was interesting, and kind of talked for just a few moments about it. But as a result of that, we have decided to add the data dashboard to our monthly agenda item and explore a different area each time. So this is the first one we're going to explore, is kind of the cases carried forward, and kind of talk through, like, is their data an anomaly? Is there something different? Is someone else's data anomaly that makes theirs look wrong? So we're kind of excited to have a different area to explore each time and keep the conversation going about the 242 and the data dashboard and how to use it.
Right. So I thought that that was a good example of one element that was kind of like, well, wait a minute, why are we so different? So was this looking kind of at the southern region and how that county stood apart a little bit? Is that?
Yeah, I think they were looking at some of the counties they thought were comparable to them, and that brought it up, but then kind of looking across them. So I'm sure we'll talk among Southerns, but we might look at other counties that we kind of know to be similar in either size or structure to kind of see how are we different, and then talk about why would that difference exist.
Okay, cool. All right. So any questions about what we are asking y'all to discuss before we go in? And then Rabaz has put the questions and info in the chat box, so it'll follow you. So, all right, well, here you go. All right, have fun. See you in about 20